is Colon Cancer Awareness Month. It's the third leading cause of cancer-related deaths in the United States, and Jen Tom is here with who should be screened for it.
Liz, while colon cancer is one of the top causes of cancer deaths in America, it's also one of the most commonly diagnosed cancers. Dr. Paul Sturrock, an attending physician in the colon and rectal surgery department at UMass Memorial Medical Center in Worcester, joins us live via Skype for today's House Calls. Dr. Sturrock, let's start with the basics. Why is it important to screen for colon cancer?
Well, first I just want to thank you for having me on so we can discuss such an important topic. It's important to screen for colon and rectal cancer because, as you mentioned in the lead-in, it's the third leading cause of cancer death in the United States, despite widely available technology to be able to screen and prevent this type of cancer. We have seen a decline in the incidence of colon and rectal cancer in the last several years, but it still remains high among the cause of cancer death. And for those of us that take care of it on a regular basis, taking care of people who develop a preventable cancer can be very disheartening, and we like to catch these cancers before they affect patients so significantly.
So what are the guidelines for the screenings?
The national guidelines developed by the task force headed by the American Cancer Society include for average risk population patients to be screened once they hit age 50. And that's either with a colonoscopy every 10 years from the age of 50 on, or through use of a newer technology called virtual colonoscopy or CT colonography every 10 years. Other patients who are at increased risk, whether they have family members affected or have their own personal history of polyps, should be screened 10 years earlier than their family member was diagnosed, or starting at age 40 if the age of diagnosis of their family member is unknown. There are some patients who fall into a high-risk group, such as those with familial predilection towards colon cancer, and those people should have an increasingly aggressive screening regimen, which should be discussed with their doctor.
Now, is there a way to prevent it? How about diet or certain things you should do?
There are ways to be able to lower your chance of getting colon cancer. Regular physical activity, as well as eating a healthy, high-fiber, low-fat diet have been shown to decrease the incidence of colon cancer. But one of the things that we discuss so loudly now is that using these screening tests is a way of preventing cancer, because the polyps that can develop will turn into cancer. They can be detected by the screening tests and removed before they even have a chance to turn into cancer.
So where can consumers get more information on colon cancer and treatment?
There are many society websites nowadays at the American Cancer Society, the American Society of Colon and Rectal Surgeons, the American Society of Gastrointestinal Endoscopists. Here at UMass, we've recently launched a new website, www.colonandrectalsurgical.org, which has our own listing of these guidelines and information for screening tests available for colon cancer. This also provides links to the other societies that I mentioned earlier.
Okay, well, thank you so much for joining us for this afternoon. Now, if you have a question you would like to ask a medical professional during one of our live Skype interviews, just email us at housecalls@cbs3springfield.com.